Hi, everybody. Welcome to today's Career Chat. I'm Krista Harmon, a workforce development consultant with the Kent ISD in Grand Rapids, and I am so glad to have Elizabeth Brown with us today. She's an autopsy technician. Welcome, Elizabeth.
Thank you. So,
So I'm going to take you back
okay,
to when you were
okay.
16. We love to start career chats that way, and I've been fortunate. I got to meet Elizabeth in person pre-COVID, took students into the morgue. So I'm excited for you guys to learn some of the things that I've learned. But take them back. You know, when students are watching this, they want to know: did you want to do this when you were 16? What were you thinking?
So actually, in 16, those young years, I wanted to do something in medicine. I wasn't exactly sure what I wanted to do at that point. I thought maybe the ER. I liked the action. I liked some of the busyness. So my thought was possibly ER. I had a family member who was a funeral director, so I knew of autopsies at that time, and thought maybe that was a possibility as well. So when I was, about that time, I actually came in and I spoke with one of the pathologists here, one of the head pathologists here at Pelagic Hospital, or with the Kent County Medical Examiner's Office. And I spoke with him, Dr. Cole, and got a little bit of information on what career paths looked like, what options there were to work with forensics, and how I should go about proceeding with college. And he gave me a good recommendation of different colleges you could attend, maybe some career choices or majors that we should look into. And I chose to go to Albion College, and I have a major in biology and a minor in history just because I had those courses. Thought I might as well get a minor in that. So I got a major in biology, and that was what they looked for being an autopsy tech. They want a bachelor's degree in a science. And then from there, if I wanted to become a forensic pathologist, which, like what I said, that's what Dr. Cole does. If I wanted to do that, I was able to. I could go to med school, but that was not my not my path that I wanted to take. That's a lot of schooling and a very tough, long journey. So that was not exactly my path that I wanted. So I decided to go be an autopsy tech.
Well, we're gonna
So
just a second, Elizabeth. We're gonna dig into that for
yeah,
sure. But I wanna just point out the fact. Did you say you were in high school when you actually reached out to get some information
I
about
did.
career?
I was in high school. I was about
Yeah.
16, 17 years old when I reached out for the forensics department.
So
Yep.
I want to dig into this a little bit because young people maybe don't realize that they can do that.
Yeah.
So when you want to explore an occupation, it's something called a job shadow where you get to follow along somebody, but
Yep.
it sounds like you were just looking for a conversation. How did you actually get a hold of Dr. Poole? How did you dig into that? Help these young people understand how to be resourceful.
So if there's I fortunately had a connection. One of my family members knew where to go or how to go about doing that, and so I was able to use that connection. However, not everyone has that. So if you're on Google or whatever, you have a career path. If it's at a hospital, if that's where you're aiming to go, contact that hospital and see if there's a doctor or a nurse or whoever you may, whatever path you want to take or you think you want to take, and reach out to them and say, is there someone I can come and talk with? Is there someone I could job shadow, like you said, summer internship? Even if it's not in the exact path that you think you want to take, but if it's something close. I also spoke with a crime scene or crime scene person with MSP. Just another option of, if do I want to do autopsies? Do I want to do crime scenes? I don't know. It's something that interests me, and so to get a good idea of what they do and what's available, it's great to go talk to these people that are in this profession and see what path you want to take and what options you do have. So
So let me go back to your thinking too as a 16-year-old, because you originally started thinking about going into medicine. So do you remember the time when things kind of shifted to work with people who had passed versus healing people? Do you remember that thinking?
Part of it, yeah. So like I said, initially I was thinking maybe ER, but again, that's it's crazy. It is chaotic. For me, it was a little frightening, as I don't want to do the wrong thing. I don't want to hurt the person. And I'm sure everyone has that. But for me, I'm not a very loud person. I'm not a very outspoken person. I'm just a quiet, more quiet individual. And so something with working with the people who have passed is was a better option for me. And even though I do autopsies on people who are passed away, I'm still doing this for their families. I'm still doing it for the living. Um, I'm more in the background, which is where I'm comfortable being. And some people want to be right out there in the front, and I get that. That's fine, but that's just not my cup of tea. And so I was okay with being in the background and working down here again, getting answers for family members, but not being the one in the spotlight. So.
Yeah, I think that's really important for young people to do some of that self-assessment. Like you said, you were looking at your personality, what you had some fears around maybe hurting somebody. Like, do that thinking, and there's a job in health that will fit you. So young
Yes.
people just know that. So you were you a pretty good student in high school that you were thinking medicine?
I was a decent student. I was an average student. I wasn't the highest. I definitely wasn't the lowest. I was an average student. I was active in sports as well. So, um, I wanted to continue that in college. So I did for a little while. And so I knew, with being active and my decent grades, like I said, I wasn't, an all star there, but, I knew that that was the path I wanted to take. Could I have been a doctor? Yes, but that's not exactly what I wanted to do. That's, again, like I said, a lot of schooling and a lot of hard work and dedication. And that was, I was comfortable being that tech, and that's something that I really wanted to do. So
Yeah, and I think that's really important for young people to understand. It's how they tick, like you say. Summer is almost a gift to go that long haul for school. Not everybody has that gift of being able to pursue that. So you went to Albion, you got your degree in bio with history. And how did you start to nail down the autopsy tech versus a crime scene technician, for example, with the police department? Because I think a lot of young people don't understand that some of the jobs, there's different titles for similar work. So maybe you
yes.
can help them understand kind of your thought process.
Yeah. So after I graduated, there were no positions available. There's very few facilities in the West Michigan area that do autopsies. Actually, we are the only one, Kent County wise. Right now, that everyone else is kind of Lansing, Kalamazoo area. So this was it. There were no positions open at the time. So I wanted to continue to be in the hospital setting. So I actually worked at St. Mary's for 2 years. They call it a diener, or I worked in the gross room. So I did that for 2 years. If they had autopsies of individuals who passed away in the hospital, I would help with those. So that is how I got my first initial autopsy experience. And I started there for 2 years. And then after that, again, with connections, there was a doctor who came and worked there, as well as here at Butterworth. It was at Butterworth at the time. And he was able to say, there's an opening available. It would be a good opportunity. You'd be an awesome fit. And I applied, and I was able to get in. Again, I had also spoken with Dr. Cole after graduation just to see, what are my paths? What should I do? Like I said, I had spoken with someone at MSP to also get an idea of that. And I felt the autopsy was a better option for me. But I was still open to being a crime scene tech. And then when that position became available and I got the position, I have now been here for 15 years, and I'm loving it. So.
Yeah, that's great. A couple of things I want to point out for young people. MSP is Michigan State Police.
Oh, yes. Sorry. Yes.
And I would love to help you, ask you to describe a little bit, because this is a terminology that young people may not know, on what a diener is. You say diener or the gross room. What does that mean?
So a diener, what I did as a diener, I worked in the gross room. It's the room where if there's a surgical specimen removed from an individual living during a surgery, a gallbladder, an appendix, any organ or tissue, even a skin biopsy or a little skin shape, that would go to the gross room, is what it's called. And you look at the specimen, or you look at the tissue with your naked eye, looking for anything abnormal, making sure that there's, and if there's anything abnormal, that you're testing it. And so that would be the gross room. That is done by a pathologist assistant. And from there, the deaner would be the person who would help get all the specimens ready or the tissue ready, assign it a number, and do some charges, as well as help with other duties that the pathologist or the autopsy assistant, or sorry, the forensic pathologist may need. So so as a deaner, I also helped with like I said, the autopsy portion. So there at St. Mary's, it was very minimal help, but I would after the autopsy was complete, I would help clean the body, I would sew the body up and get it ready for the funeral home. So that was our duties at St. Mary's, which is different than what we do here, but still on the same track. And at least I got introduced to those autopsies there. So
Yeah, and what a great entry-level position. Like you said, right out of college, you're getting your hands in there, learning the stuff, learning
yes,
terminology and all that, and connecting. I guess I want to point out that you were continuing to network with Dr. Cole. I want young people to understand that that's important to keep those relationships going.
yes,
A lot of young people will think, well, I don't want to annoy them or I don't want to bug them. What is your thought on that?
do it. Do it. Um, Talking with them, it's not bugging them. They are happy, and I'm doing this. Dr. Cole talks to students all the time. We are proud to do what we do. We are excited to introduce young people to what we do. This environment here is not something that most people know about. So for us to be able to teach young individuals or even older individuals that may not know that they want to do this, but they have grown to find that this is actual a profession. We love to teach people what we do and how we do it and what the road that they need to take in order to get where we are. And it's not just us, Dr. Cole and myself, or any of the other techs here would do the same thing, or Dr. Starr, who is another doctor here, he would do the same thing. But it's all over. People are willing to talk to individuals, young individuals, like I said, even older people, and educate them on what they do and what they love about what they do. So
Well, I know we're delighted to have you. So that's probably a good time because we're going to dig into a little bit about what autopsy is. So if you
yes.
want to pull up your slides, Elizabeth brought a few pictures for us and tell us kind of what the scope of your job is. And then I'll have a few more questions about like what your favorite part is, what your least favorite. But let's talk about just what you do on a daily basis.
So on a daily basis, we do autopsies, which is an individual will pass away. With the types of cases we do, they're medical examiner cases. So they're going to be suspicious, maybe even natural deaths, but we don't know why they passed away. So we do the autopsy to determine that. So what we do as techs is we get the individual out and we put them on a table. I actually have sorry, I'm going to go through a couple pictures here.
Oh, that's great.
This is our autopsy facility. This is the room I'm actually sitting in now as well. So we would get the individual out, put them on these tables, inventory all of their clothing, any jewelry they may have, any injuries they may have, and we're going to document all of that. Once that documentation is done, we are going, and that's with photographs, paperwork, everything. So a doctor also does a report as well. So they're also in the report. After that's all documented, we begin the internal process or the internal examination. And with that, I don't know if I can get to the next, let me go here. We open them up. So we use these tools here. The big long ones on the left are the rib crackers. So those are what we use to open the rib cage. You can see a scalpel blade there in the middle. We use that to cut all the tissue out, even open the skin. We have a syringe there. We collect fluid for toxicology, just to run, we call it a full tox screen. So we would look in the blood, the bile, the urine, and the gastric, and we would look for any medications, whether they be therapeutic, illegal, maybe something that someone had given them. We make sure if there's none of that in their system, maybe they may be dehydrated or anything like that. So we're going to collect fluids and test all of those to help with our cause of death. You can see some scissors and some forceps in there. And then the T-shaped device at the bottom is what we would use to help open the skull or the calvarium, to open the head to get the brain out. You can see the bone saw at the top. That is also what we would use for taking the skull cap off. It's also called the calvarium, to take that off and to access the brain. So those are some of the tools we use. For the autopsy, we would do a Y-shaped incision, stereotypical what you see on TV. We do that on every single case. We reflect or remove the skin off the bones just on the torso area, not anywhere else. But we remove the skin, use those rib crackers to cut open the chest. And then we start, as techs, we start removing the organs. We will remove the heart and lungs, hand those to the doctor, and the doctor will do what they need to do. We remove the liver, the spleen, the stomach, the intestines, and the bladder. If it's a female, we remove uterus, tubes, and ovaries. If it's a male, we remove the prostate, kidneys, all organs. So we would remove all of the organs in the torso area. Again, as techs, we do that. We hand them to the doctors, and the doctors will do what they need to do. Similar to that of the grossing room that I had spoken with before, with surgical specimens. So they will do whatever they need to do, collect what specimens they need to collect what tissue samples they may need to collect. And then from there, the tech will also open the head and remove the brain, again, giving that to the doctor as well. So we do complete autopsies in which we remove all of the organs, and those organs do get looked at with their eyes, with just the gross eyes of the doctor, as well as microscopically. So it's very, very, very thin sections underneath a microscope. They'll look at those at a later date when those come back. After they're able to look at all of that, they'll look at the toxicology, or the blood, urine, bile, gastric specimens that we collected at the time of the autopsy. They'll put all of those results together in a report, and with those results, they hopefully 99% of the time can get a cause of death. There are some times where it's difficult for them for reasons, either there's parts missing or they just can't find anything. But like I said, 99.9% of the time, they're able to come up with a cause of death, putting all of those bits and pieces of that puzzle together. Sometimes we know when they come in, you can see what their cause of death was, whether that be a gunshot wound or something like that. But there are those times where it is not obvious to the naked eye at the time of autopsy, where you can't see, and they do need to look at everything microscopically, look at all the toxicology and everything. So those are some of our tools.
Can I interrupt you just for a second? Because as you're describing, Elizabeth, I know that for some young people, they might be thinking some of that's kind of like graphic. Like how did you get used to seeing it? Or was it something that is just natural for some people that they can see past that? Kind of dig into that for me.
Yeah, so we know that this is not for everybody. We have medical students who come through. We have residents. They're not going into pathology, but they're going to other medical fields, and they will come in and do what we call as a rotation. So they'll spend 2 to 4 weeks with us, observing what we do, and to help with their medical field journey to get to where they want to be, whether that be working in the ER or being a radiologist or something like that. So they will come just do rotations with us, and some of them are okay with it and some of them are not okay with it. So we understand this is not for everybody. For us here, it's something, the first autopsy is always a little shocking, or just something you need to get used to. And it's something that you don't always get used to depending on the case. So some cases are more graphic than others. Some of them are just routine, but you have to look at it as you are getting an answer for the family. You are doing something for their loved ones. You are, like I said, getting them an answer of what happened, and maybe even helping the police to solve a murder. So that is how we look at it. You do have to kind of disconnect yourself from what's going on depending on the case. But when you've been here, you've seen a lot. you kind of become desensitized to it in a way. And it's going to be the same way in the ER. Yes, you will be sensitive to things. Some things will be more difficult, but some things it is, you have to look at it as it is part of life. Maybe not in the way that in which they passed away, but we one day we will all get to this point, and you have to hope that maybe if something tragic happens, that someone is going to be respectful of you, just like we are here. So everything we do is in respect for the person who has passed away. After an autopsy, they're still able to have an open casket if that's the family's wishes. Nothing we do here is disfiguring. Everything, all of our incisions we make are hidden, whether that be in the hairline above your head or on your chest. They would still be able to wear a collared shirt, an open collared shirt, and you would never even know that they had an autopsy. So everything we do is very respectful, but it's an answer that needs to be gotten either for the family or for the police. So that is kind of how you have to look at it, is just you're getting an answer. So
Yeah, so you're a problem solver through and through. So I appreciate you taking that minute to explain that. You had, I think, one more slide of
oh yeah,
X-ray.
yes.
Because I'm wondering, I know young people are wondering this because I am, but like, what is one of your most memorable cases, whether it was for a positive or negative reason?
So, my most memorable case, there is an X-ray. So we do X-ray all of our individuals who may have been shot. You can see here that we're pointing at a bullet that is located. We need to locate that bullet for the individual. Probably maybe the most rewarding case, and this is not a specific case, but just they're rewarding, is a case similar to this, where someone has been shot. You are trying to get evidence so that police can put that person away who has committed this crime. These bullets, sometimes they're big, sometimes they're little, but you need to collect them. There are marks on these bullets that police are able to use to match that bullet to a gun. And it is very rewarding to be able to locate that bullet, whether that be in an arm, a leg, the chest. This is an example of the chest. To be able to locate that bullet and pull it out and give it to the police and say, here you go, this is the type of bullet it is. They'll determine that. I don't determine that, and then be able to match that with a gun, to be able to put that person, that person who committed that crime away. So I would say that's probably the most rewarding thing, is to work with the police, different agencies. We work with all different agencies. Grand Rapids area, we even do autopsies for other counties. So we work with lots of police agencies, and to be able to help them to put the criminals behind bars, and as well as the attorneys who are doing, and the judges who are doing all that. It is rewarding to be able to put them away and know that you were a part of it. And again, I don't want to be in the spotlight. So to be able to do that down here and know that you're a part of it, but not need that spotlight is awesome. So that is probably the most rewarding work we do down here, and to get families answers. And the families are very happy when those answers are given to them, or in the case like this, where that individual who committed that crime is behind bars. So
That's so great. I appreciate you sharing that perspective.
yeah.
So we have about 4 minutes left. I'm wondering if there's any myths you'd like to address with this type of work that you think young people, maybe what they see on TV, you know what I mean?
So our job on TV, CSI is an example. I don't really watch the show, but I've seen enough of it, and I know people bring it up often. So CSI, a lot of what I have seen is the bodies come out, they get put on the table, people are eating on top of them, or they're always very slender, clear cut, perfect shape, makeup on. That is not how we are. We come in all different shapes and sizes. We will not get an answer for you by the end of the day, more than likely. Again, there are going to be cases where we can, but even toxicology takes 4 to 6 weeks to get back. That is just routine. In the ER, they do like quick ones, so those may come quicker, but we need a full comprehensive, what we call it, comprehensive drug screen. So we check for everything, and with so many drugs coming up, that the list is getting longer. So those Those toxicology results take a long time to come back. Our cooler is stocked full. We will not have an answer for you by the end of the day, more than likely. And again, all shapes and sizes. People sometimes are deceased for a period of time before they're found, so they're not all fresh.
Well, that's what I
And there's
was.
not police everywhere like they are on TV.
Yeah, that's what I remember. It's really not even, and this is for young people, and I'm not saying this to discourage you, it's just a reality. It's not necessarily what you just see, it's what you smell.
Oh yeah.
That's a big part of it. So just know that all the senses, and that's why job shadows are going in for a visit, like to start to see if this fits you, you know, because everybody has a gift. And like Elizabeth, she loves her work. And
Yep.
this is so awesome to have people who love their work. As we approach our last 2 minutes, Elizabeth, I'd like you to, obviously being a problem solver is really important. So give a couple characteristics of people who do well in this kind of work, and then kind of finish off with a word of wisdom.
Yes. So people who do well in this environment, you have to have a sense of humor. You have to be able to desensitize yourself to a certain extent. I'm not saying that you just need to be blank. But you need to be able to separate yourself from the case, know that you know your purpose and why you're doing this. So getting answers for the family, getting answers for the police. We listen to music down here. We have fun. We're a very small group, so you need to be able to get along with people well. Most people can. So that would probably, my biggest thing though is to be able to separate yourself enough that you're able to do this job. Again, it is not for everybody. There's a strong odor sometimes. So yeah. My words of wisdom: if there is something that you want to do, find someone in that area, whether you're using family members to help you or friends to help you. Use your connections and contact somebody and ask them. You may not be able to get in right away. We have an age limit of 18 to see an autopsy, but you could still, next week I'm giving a tour to a 16-year-old, and I'm going to walk her around and do something similar to this and talk to her. So you may not be able to get the full experience quite yet, but you will get there. Keep it up, keep bugging them. It works.
Absolutely. I think that's such a great encouragement as we finish up. And Pamela just asked, you know, do tax work as a team, or you're individual, but you're definitely part of a team as far as everybody that does their part stuff.
Yes. This
awesome.
is definitely a team environment down here.
I hate how fast it goes, Elizabeth. It was so enjoyable. Everybody's loving learning, and you've been a great role model today. Lots of love coming in that chat. So thanks for being here today.
You're very welcome.